All right, I'm back here with John. Hi John, it's Hannah. Can you tell me your name and date of birth, please? Fabulous. I will make sure that that coincides with his medical records and his wristband are the same. John, we got some doctor's orders today to take that Foley catheter out, so we're gonna go ahead and get that done for you. Hi, buddy. First and foremost, I'm gonna check for allergies, check to make sure that he's tolerated it well, just review nurse's notes about how it went putting it in, anything like that. I'm gonna empty the bag first off and then document what he had in his Foley catheter bag. And then I'm going to pause. What? Oh yeah. I'm going to make sure that he doesn't have any unwanted visitors in his room, and make sure that he's only exposed as much as I need him to be, and only will I need him to be. I'm going to make sure I have a bath basin handy and an empty syringe. I did note in his chart that the nurse that put the Foley catheter in filled it up with 3 cc's, and so I'm going to make sure that when I take it out and deflate the balloon, I have 3 cc's in my syringe. So first I'm going to put on my gloves after I wash my hands and I've verified his identity. Make sure that he has a blue pad underneath him to protect his bedding. And I'm going to go ahead and do that. Take the tape off. All right. Again, want to make sure that I get the full 3 cc's back out of the balloon. All right, I'm going to have him take a deep breath. And I'm going to go ahead and remove the catheter. So, I'm going to go ahead and wrap that up. And this I'm going to dispose into the biohazard. Ooh, trash bag. All right, I'm gonna grab my clean warm water and with a clean rag, I'm gonna do some pericare. Wash around the urethra opening. Use that. Go further down the shaft. Use that. And then down the shaft of the penis in his peri area, make sure that he's good and dry and clean. If he is not circumcised, I will replace the foreskin to its comfortable position. Go ahead and get rid of that. And I'm going to make sure that he's clean and comfortable, covered back up. Make sure he doesn't have any questions. I'm going to document my notes about the urine that was in the Foley bag, as well as if he had any discomfort while removing the catheter, and how he tolerated the procedure. I'm going to document that I was able to obtain the 3 cc's of fluid back out of the balloon and the catheter. Make sure his bed is lowered, he has his call light. I will also want to make sure to educate the patient, make sure that he's getting enough fluid intake, really push the fluids, and verbalize to him that I would like to be present for his first void after the catheter comes out so that I can make sure things are working as they should be. And I guess after he voices any questions or concerns, I will wash my hands and head on out.